The Oregon Health Authority just announced an astonishing new daily case count. That number, 10,451 cases, dwarfing previous records. This marks the fourth day the state of Oregon has broken its daily case count record. The health authority says case counts are a sobering reminder of the formidable challenge that lies ahead. Hospitalizations are also up 57% over the prior week. Those numbers from the health authority show just how dramatically case numbers have risen in just the past month alone. As you can see, we now have 10 times the number of cases versus this time 1 month ago. Now, Oregon Governor Kate Brown is also calling the National Guard back in. Around 500 Guard members are being deployed to help hospital workers during this Omicron surge. 125 members will begin heading out next week. So who lives and who dies? Questions local hospitals may soon face as the anticipated surge of Omicron is hitting our region.
Today, state health leaders talked about a crisis plan that they have ready. Lisa Balick is live in downtown Portland with details. Lisa.
Yeah, it is just simply hard to imagine that hospital staff could have to make these decisions, and these decisions could have to be made in just a few weeks. Now, today, healthcare leaders from around the state laid out their plan, what they call a document called a crisis care tool. It's guidelines if there is not enough staff or equipment to save the lives of every patient coming in the door. State healthcare leaders are trying to ensure there's equity, no discrimination against patients based on factors such as age or even whether they've been vaccinated against COVID. The care decisions would be based on the likelihood of survival. In other words, will you eventually be able to walk out the hospital door?
In the case that there are inadequate critical care resources to meet the needs of the patients who've presented to a hospital, the evaluation will occur for all the patients needing critical care to make that assessment on who's going to need to be able to get those most critical care resources.
The crisis guidelines are for the worst case scenario after hospitals have transferred patients to other facilities, delayed non-urgent surgery and care, and using existing bed and space for critically ill patients. Right now, there are only 42 adult ICU beds open right now in the state, and the expectation, the projections today was that there will be more than 1,500 people hospitalized with COVID in Oregon, likely by the end of the month. I'll have much more in this developing story today at 5. Live in downtown Portland, Lisa Balick, KOIN 6 News.